The next disease is called decompression sickness. It has another name which is called the bends. It has another name which is called the scuba divers. If you don't have time for the exam, then all you need to know is three things. The first thing is that symptoms of this disease begins within 12 hours of surfing. And the second important one, which usually is asked in the question, is the pathogenesis of this disease, which is vascular air embolism. We will explain how air will make an embolus. And the third one, which is the treatment. How do you treat such patients? First, you change their position. And the second one, you give oxygen, as we will see, because the patient will have hypoxia. And the definitive treatment for such patients, or the optimal management, which is called hyperbaric oxygen therapy. So that's all you need to know for the exam. If you have time, then let's understand what's going on in the disease. First of all, why is it called the bends? Basically because the surfers or the divers usually bending like this, bending their joints. Why? Because this disease affects the joint and causes joint pain. That's why they bend to reduce the pain on the joint. Why is it called scuba diver disease? Because it mainly affects these divers. Okay, first of all, let's talk about the normal and then talk about the pathology. The air that we breathe consists of oxygen, nitrogen, and other gases. And the main focus here is on the nitrogen. Now, the bottle that scuba divers also use has nitrogen in it, as well as oxygen and other gases. When we breathe, the air that we breathe, it has 70-80% of nitrogen. Under normal pressure, which is at the sea level, this will allow some of the nitrogen to dissolve in the body, and some of it will be in the blood. And the excess of it, the lungs will immediately get rid of it. So any excess nitrogen in the blood, the lungs will get rid of it immediately. So what happens with the scuba divers? So when the divers go under the water, when they dive deep, the pressure will increase. So the more they go down, the more pressure that they will have. Now this increased pressure will cause these small nitrogen gases that in the blood to dissolve in the blood and tissues. So basically, you will not have any air nitrogenous bubbles running in the blood, because everything will be dissolved, whether that's inside the red blood cells, whether that's inside the wall of the blood vessels, or inside the tissues, whether that's muscles or organs. So as long as you are down, as long as you are in this high pressure and the nitrogen gases are dissolved in the body, there is no problem. So the question is, when will there be a problem? Is when the scuba divers will go up to the surface quickly. So the most important word is quickly, is when they return to the surface too quickly. Why is that? Is when they return quickly to the low pressure. Do you remember all the gas bubbles that were dissolved in the blood and tissues? In the low pressure, these gas bubbles will come out. All of them will come out quickly and suddenly. And when they all come out, they will start coalescing with each other to form a big bubble. So when they quickly come out, there is a rapid pressure drop from high to low, and then the nitrogen will start coming out of the solution from the tissues and the blood, red blood cells and other blood components. It will come out too quickly, and then all these small bubbles will form a giant big bubble. Not only one, but many giant big bubbles in the bloodstream. Okay, what will happen if they can come out slowly? slowly coming out. This nitrogen will start coming out gradually, uh, and this will allow the lung the will give the lungs some time to get rid of these nitrogen bubbles. And that's why the disease is called decompression sickness. It's because rapid decrease in pressure, which is called decompression, when the diver experience when they are ascending from depth. The next question, will these small air bubbles form mainly in the veins or in the arteries? Why is this important? Because if they are in the arteries, they will create different symptoms from the ones that are in the veins. And the answer is both, but mainly in the vein. The question why are the veins more affected than the arteries is because the venous has lower pressure. So when they come out quickly from high pressure to low pressure, as well as the lower pressure in the vein than the artery, this will allow more nitrogenous gases to form and come together to form small air bubbles or large air bubbles. And it's easier for this bubble to form in the lower pressure than the higher pressure, which is in the artery. However, these small bubbles can form in both, but mainly sometimes the symptoms start with the vein and later comes in the artery. So the first symptom that the patient will have, all these air gases, air bubbles, will go through the inferior vena cava and superior vena cava and go to the heart and then end up eventually in the lung. So the first symptom that the patient will have is hypoxia. Because these air bubbles will obstruct the blood flow in the lungs. So the patient will come with respiratory distress or hypoxia, as well as when we hear the chest, there will be edema or crackles, bilateral crackles. Why there is bilateral crackles? Because there is these air bubbles are obstructing the blood, so there is build-up of pressure behind these bubbles, and then all these blood vessels will start leaking out and cause edema. Sometimes all these small bubbles that will go back to the heart through the vein will sit in the ventricles, and then small bubble with a small bubble with a small bubble, they will form a giant bubble in the right atrium or right ventricle, and then they will obstruct the pulmonary artery, and there will be no blood that will go to the lungs and the left side of the heart, and this will cause obstructive shock. This usually happens if the bubble is very large, which is about 50 ml, and the patient usually comes with cardiac arrest. Some of these air bubbles will also travel through the veins to the venules and then capillary in the skin, and that's why you will see mottling of the skin. So the patient will come with pruritic skin, as well as you will see mottling or cyanosis of the extremities. And this is what I mean by mottling. And bluish color or cyanosis of the extremities. And of course, there are some air bubbles as well in the arteries. And these air bubbles could go anywhere, basically. And of course, the most common organ that is being affected is the brain. Even a small bubble, which is the size of 1 to 2 ml, can cause ischemic stroke. It can either affect the cerebrum or the cerebellum. That's why sometimes the patient comes with cerebellar dysfunction, or sometimes cerebrum dysfunction, like left arm weakness, or if the patient is hemiparalyzed and facial droop and can't speak properly. Sometimes these air bubbles can also be in the heart and cause myocardial infarction. So we have the vein, and that's for the lung, and then we have the capillary, that's in the skin, and then we have the artery, that's in the heart and brain. How do we treat such patients? We give fluids because the more we give fluid, the more of these nitrogen bubbles will dissolve in that fluid. And the most important thing is we give 100% oxygen administration immediately, because there is hypoxia in the body that we need to treat, so we give more oxygen. And we change the position of the patient, which is called Trendelenburg position, which is basically having the patient upside down. The reason we do this is because we want to increase the venous return to the heart. So probably the lung can get rid of these bubbles, and we can protect areas and organs like the brain. And the last one, which is a machine called hyperbaric oxygen therapy, which is basically a machine that will give the patient 100% oxygen in a higher pressure, and this will allow the oxygen to dissolve more in the tissues that are being affected by these bubbles, rather than breathing through a mask. This machine will give pressure to make the oxygen dissolve more.